Every 3 days, someone in Ontario dies waiting for an organ transplant. That is a sobering fact, only somewhat offset by another one. Last year, there was a 30% increase in the province in the number of organ donations from deceased donors. Joining us now to understand what's behind those numbers and what's involved in these remarkable medical feats. Ronnie Gavsey, she's president and CEO, Trillium Gift of Life Network, that's Ontario's organ and tissue donation agency. Dr. Leslie Lilly, medical director, gastrointestinal transplant, Toronto General Hospital. Kimberly Young, director of donation and transplantation with the Canadian Blood Services. And Dave Ellingham, recipient of a heart transplant in 2012. Great to have all of you around our table here tonight for a discussion, Dave, that, sorry about this, really gets to the heart of the matter. Here we go. I want to know all about you. For example, why you ended up needing a heart transplant in the first place.
It was actually a genetic disease, and it's called ARVD, arrhythmogenic ventricular dysplasia, and it was a disease that ended up taking my father's life. He was only 36 years old.
When he died?
In 1977, yeah, he was a very young man. So I kind of grew up with the Ellingham heart. It was categorized in my family, so I really didn't know, but as I was getting older and I got up in years, it was always in the back of my mind that is this going to affect me? Because at the time it wasn't genetic. They didn't deem it as a genetic disease.
How old were you when you first started to notice problems with your heart?
I was 31, yeah, I was early on in my 30s, which is a window of this disease that they've come to know over the last 20 years.
And did they tell you at that time, at some point, you're going to need a new one?
Not then. They diagnosed what the disease was, so we understood what actually my father passed away of, but they started to treat it with medications, and I actually had an ICD or a defibrillator implanted into my chest. There is no cure for this disease at this stage, but it is a fatal arrhythmia, and left untreated, I would have probably passed away the same way my father did.
So at some point, you're on a waiting list, waiting.
Yeah, I got to the point where I actually went through a number of heart surgeries to try to actually bridge that gap and try to correct things, and before we got to transplant. As most people are aware, and those that aren't, organs are not on shelves. So to get to that point, the waiting list has a lot of risks. So to...
Is that you?
That is me.
That doesn't even look like you,
correct.
Dave.
I know, it's looked a lot different back then,
Yeah.
so absolutely. But that's actually after the transplant. So actually I'd had the transplant and I was alive. There was a family out there, as I phrase it, gave me that unconditional gift of love. It was not just a donation, it really was an unconditional gift of love.
Well, in fact, we were kind of joking before we started our discussion here. You got the youngest heart at this table.
I do. I absolutely do.
Tell us about that.
Yeah, I've had the opportunity to actually meet my donor family. It was actually through a mutual friend, believe it or not, someone that I worked with, and social media. We were able to meet. Because of the Privacy Act in Ontario, in our province, donor families don't have that opportunity to meet for various reasons. But I was fortunate enough through the means that I talked about to actually meet them, and they are family now. So unfortunately, it was their son, Tyler, who passed away at a very young age due to a tragic accident. That he went on to actually save 7 people's lives, I've come to understand.
There's Tyler. Tyler had his earbuds in and walked across the street and got hit.
He absolutely did. Amazing young man. He's my hero, and many others. But like I said, he's given me my life back. He's given me the opportunity to raise my kids, to be a friend, continue relationships with my friends and family, and to get back into even getting back to work and getting back to giving back to my community. So one of the reasons I'm actually here, Steve.
How do you feel?
Fantastic. In about 4 weeks' time, I'm going to be riding down here on the Gardiner Expressway in the Bayside Ride for Heart, something I've done ever since my transplant. My first year, I rode 50K, and I'll be doing 75 this year. I've done that ever since, so fantastic.
There you are. Good to go.
Yeah,
you were
that's Kim, actually. Amazing woman. Tyler's mother.
Tyler's mother. You were a big-time cyclist even before you had the transplant, right?
I was, yeah. I loved cycling. It's something I've done for many, many years. But unfortunately, once I got sick, I literally, that phrase, a couch potato, I didn't move a lot. I got to the point where my activity level was down to nothing. I was off work. I was literally sitting on the couch until I was actually hospitalized, where I was in a bed and I didn't leave the bed. Just standing up would invoke arrhythmias and cause all kinds of problems. So I was bedridden to the point where I was put on a BiVAD machine, which was essentially my life support, waiting. So waiting for that unconditional gift of love or that donation from a family out there.
I presume at some point in this process, your mortality stares you right in the face. Did you ever think at some point, I'm not going to make it?
To be honest with you, it's a reality. I'm someone that loves to do my homework. I understood where this could take me, but it never entered my mind. There was not a point in time where when my kids were visiting that I ever said goodbye to them. I never gave up. I got to the point though I was taking hour by hour and day by day. I had no idea what was going to be coming my way in the way of another test or something else occurring or another complication. But I just decided I was going to take it day by day, deal with whatever came my way, but I wasn't going to give up. And so I knew it was a reality, but no, I can't say I never gave up. I didn't. And often people came into my room and they said, you seem very relaxed and calm over all this and with my mortality on my doorstep. But there was nothing I could do. I often said to people I could sit and cry all day. I could get angry at all these people that are trying to help me. I could get angry at the world. It wasn't going to help me. So my best coping mechanism was to just face things straight on, and when it came, deal with it and work through the issues and wait. And hopefully that there's a family out there that's going to make that decision and give me a second chance at life.
Congratulations.
Thank you. Thank you.
Let's broaden our discussion now. We want to take a look at the situation across the province of Ontario. We're going to get our other guests into this, but first let's just do a little background information with this setup pack. Sheldon, if you would, let's roll it. There were 1,302 organ transplantations in this province in 2016. The transplants came from 351 deceased donors and 256 living donors. Kidneys remain Ontario's most transplanted organ. Last year, 720 kidney transplants took place. There are more than 1,545 people on the wait list. 40% are female, 60% male. The largest group waiting, 51 to 60-year-olds. Ronnie, why don't you pick up the conversation here and give us some understanding of how this actually works? Because in an amazingly short period of time, when a donor's organ becomes available, it can go from one part of the province of Ontario very far away to another and end up in somebody else's body in 28 or 24 or 48 hours, right? How does this happen?
Let me try to describe it using two sides. First, we have the person on the wait list. This individual has visited his primary care physician who has diagnosed a problem and referred him to a transplant physician. The transplant physician has determined that transplant is the necessary route. That person will wait on the wait list, having continual tests for what might be days or might be years. The wait list is held by the Trillium Gift of Life Network, and we continually update the status of this individual as the test results come in. The other hand, Trillium Gift of Life is notified that there is a potential donor somewhere in the province. We are notified through a call from the hospital that there has been a death or an imminent death. And we have a group working 24/7 at our headquarters, which happens to be in Toronto. These are people wearing headphones with screens around them. It's like air traffic control, and they're very specially skilled at putting into motion a number of fragile, time-sensitive steps. First step will be check whether this individual has registered consent by going into a ministry database, transferring that information to a Trillium coordinator who's with the donor family. The coordinator goes into the donor family to request consent. And whether the individual is registered or not, we ask for consent. Consent having been given and further testing have been done, we then, Trillium, match this donor to the best possible batch on the wait list. The person on the wait list is called in, is then set up to be waiting in the operating theater while we put in motion the recovery of the organ somewhere else in the province.
And how do you get it there?
Air.
Just put it on a chopper, get it down there?
Yes, road, but the van may be escorted by police, by firefighters, by emergency service.
Okay, let me get Dr. Lilly to pick up the story here. How well does this system work to serve Ontarians?
Within the limitations of the shortages that we face, it actually works quite well. I work in the liver transplant program. We have 200 patients waiting for liver transplants in our program, and we do a liver transplant, almost every other day at Toronto General Hospital. And although patients are often called in and it's a false alarm and the patients are sent home, when the patients are called in, things work like a well-oiled machine. Patients can live 3 or 4 hours away sometimes. We call them in, they arrive at the hospital, they have their blood work done, ECG, x-rays and things completed, and they're all set to go well before the organ arrives. The organs are usually coming from outside hospitals, just the way it is. And so rarely do you have a problem in identifying an appropriate recipient and in ensuring that you can match the recipient with the potential donor. So when a donor becomes available, we are very, very practiced and very, very skilled at ensuring that that organ is delivered in a timely way into the appropriate recipient.
This sounds at times like a movie, like a thriller. Do you get the situation where the chopper's literally landing on the roof of the hospital and bang, bang, there you go?
There are situations that arise occasionally where you've called in a recipient, for example, and for various reasons that recipient may not be the best one to go to surgery that afternoon or that evening. And the organ is literally, sitting outside the room, and you're really, really pressed to find a second recipient or to identify another potential candidate for this transplant as well. But that's a pretty uncommon situation. I've been involved in well over 2,500 liver transplants at our hospital, and I can really only with difficulty recall instances where the system has sort of fallen apart and things haven't happened. I spend more time dwelling on the transplants I haven't been involved in, which is the purpose of this discussion. Hundreds and hundreds of patients I've looked after over the years and have watched them die waiting for an organ. So it gives us, each of us involved in this process, a real thrill to hear that an organ has become available for one of our patients. And as I say, I drop them off at the door of the operating room. I'm waiting when they come out as well, and happy to be the first person they see when they wake up to give them the good news that they've had that gift.
That must be quite a moment.
You never get tired of it, even after, as I say, 2,500 transplants. You never get tired of it.
Great. Let's again to your point about raising awareness about the need for donations. Another background piece, if we can, and then we'll continue the discussion. Go ahead, Sean. Ralph. More than 85% of Ontarians are in favor of organ donation. 3.7 million Ontarians have registered their consent for organ donation. However, that's only 30% of the eligible population. Nearly 1.8 million Ontarians mistakenly believe they are registered organ and tissue donors. Parry Sound and North Bay lead the pack when it comes to registration. 54% of those eligible in those communities have registered. Now, Kimberly, let me get you in here because Parry Sound, North Bay, those are not big cities. Those are smaller communities. And apparently those living in smaller and or rural communities have a much better track record than those of us who live in big cities at registering to donate their organs. Tell us why.
That's an interesting question. I think from what we understand, it's families in those or individuals in those areas are more prone to volunteerism. They're interested in following through. But if you look across Canada, the bigger cities are a challenge to encourage people. More importantly, though, we can also think about age. People in the age group of over 40, having made decisions about end of life, generally have signed a will or moved forward. In the case of organ donation, not so much. As you can see, only a third, and that's consistent. So someone earlier mentioned to me, we're good at starting, not so good at finishing. It's consistent across the country that people don't finalize those express good wishes by actioning them.
So some of it is age because cities tend to have younger people living there who don't think much about these things necessarily. I wonder if some of it as well, the cities are also places where there are more immigrants and new Canadians who may come with different customs as it relates to organ donation. Might that be part of it?
That can be part of it for sure. When we talk to different groups, there is some concern with following through on those actions. But consistently, we see that Canadians, despite polls that tell us they support organ donation, are not taking that next step to action it.
They support it in principle, but Ronnie, pick up the story here because I've seen polling that says 70% of eligible Ontarians are still hesitant about donating. How come?
I think people procrastinate. Good intentions and actions are two different things. They procrastinate, they put it off the same way people put off their will.
We don't want to think about this stuff.
We don't want to think about it, and yet when you do think about it, you're relieving your family of such a burden by telling them what you want to do with your assets. Also, people are superstitious. They think if I register today or make up my will today, something's going to befall me tomorrow. Well, that is not the case. And we tell people that statistics say you are 5 times more likely in your lifetime to need an organ than to ever be a donor.
Is there any religious prohibition that you're aware of in any of the major religions in the world that prohibit organ donation? No.
Absolutely not.
So that's not it.
Absolutely what Ronnie said. It's people are suspicious or concerned.
Superstitious?
They don't action it. So they have those good express wishes. Though we recently did a poll just in this month from ISPOS in Canada, and those people that are interested in being donors, many of them, only 1/3 of them have actioned it, talked to their family or registered. So interesting as well, 80% of them say they would take an organ. So there's a support, there's an interest in receiving an organ, they just haven't finished taking that action.
I wonder about that moment. I don't know if you've ever had the conversation with the family that donated to you, but obviously there is that moment of awkwardness. You know, when the donor has died, and somebody at the hospital's got to have a conversation saying, look, I know you're experiencing the worst moment of your life here, but we need a fast decision on the organs.
Yeah, with having the honor of meeting Kim and her family, I've been able to talk about some of that, and you know, I've been able to get to know Tyler as well, which has been an unbelievable honor in itself.
The young man whose heart is in your body now.
In my body, yes. But Kim did mention to me and has talked that they never talked about it as a family prior to. So they were part of that group of families that hadn't. They weren't considering it. They were young. Tyler was 15 years old. I mean, you don't think of that with your children, right?
So do you know about that moment at the hospital when some medical personnel went up to them and said,
Kim talked about it. She talked about that's how it was her introduction to Trillium. So yeah, Kim and I have discussed that. And you know, they went through the process that Ronnie was probably going to allude to. It's how the coordinators come into the hospital and their role in this whole thing. And it's not just about, you know, coming up and asking. You know, they're there to work with the families. They're compassionate individuals. They've also been trained. I've had the honor of meeting a number of them outside of that situation, but Tyler wasn't registered, and you know, Kim and her family had that discussion right at the hospital. I know one state that Kim did say is after they'd made that decision, her family was in there, and of course they were mourning. But Kim made us, you know, brought to her family's attention that there's a number of families now that are crying tears of joy, and that's really the other side of this whole story. It really is a bittersweet story, but that is the only reason I'm here. So,
Leslie, I want to follow up with you on what happens at that moment when, let's say it is an older person who's died, and let's say that person has checked off the box that says, yes, I'm happy to have my organs donated to some needy family, but then the rest of his family or her family gets involved and they think, no, we don't like this idea. How do you resolve those issues?
Well, let me take one step back and address an earlier comment that was made. I mean, I think it requires a very skilled individual to turn the moment of awkwardness that you describe into the moment of opportunity that we really think our families deserve. The other thing I would say, and I think this is relevant to your last question, is that I think there's still an element of concern that among families that if they say that their loved one is going to be an organ donor, that will in some way influence the care that person may receive at that hospital. I think it's been made very clear here that the organ donor professionals are not even made aware of the existence of these patients until death has occurred or death is imminent as well. So we need to reassure our patients and their families that becoming an organ donor does not in any way compromise the care that they might receive. It's not like they're going to be steered down a different pathway or given different medications and stuff like that. That issue where family decisions can override, in some cases, the wishes of the recipient is still one that we struggle with. The key, of course, is in another environment, not the intensive care unit waiting room, that potential donor had the opportunity to speak to his family and to say, guess what I just did today? I just registered online to be an organ donor, or I just, in the old days, filled out the back of my driver's license and did it that way as well. Because that brings up the topic for discussion in an environment where it can be discussed sort of in a more objective way, but also I think helps to guide the family in their decision making as well. You could argue whether or not families should have the right to override the express written wishes of a potential donor, and I think that's something that's worth further debate. But I think the key is not to raise the issue for the very first time in the intensive care room, waiting room, and that's what happens, unfortunately, far too often.
But just to be clear, if somebody does fill out those forms online, or as you say, you used to check off on the driver's license, if they make clear their intention after their death to donate their organs, is that not a legally binding decision?
I'm not a lawyer, but I can tell you that I know that it is not a legally binding decision, because we will always defer to the wishes of the family. I think it helps the family to make what I would say the right decision if they know that that person is registered. And I'm happy to be corrected if I'm wrong, but for the moment, at least in our system, we defer to the family's decision.
Steve, if I may add, we have very tremendously trained coordinators who go in to talk to the family, whether the person's registered or not. And if the individual had registered, close to 100% of the time the family will consent. When the person is not registered, that goes down to 50%. Under the Trillium Gift of Life Network Act, which is legislation, the family does have the opportunity to provide evidence that they know their loved one changed his or her mind. And that is how we get around the legally binding aspect of the registration.
So if they register, you get them almost 100% of the time. If they don't, it drops to half. So the key is to get them registered.
And a conversation with the family is absolutely imperative.
Well, let's just see who does well at doing this, shall we? Sheldon, we're at midway through page 5 here. Let's do, should we do this here? Okay. Here's Canadian organ donation, 2006 to 2015. The number of transplants in Canada increased during that period of time 23%. In 2015, it stood at more than 2,500. During the same time span, Canada's living donation rate, that is donations from living donors per million people, actually went down by 8%. Canada's deceased donation rate increased by 29%. So living donors versus deceased donors, you can see quite a difference there. And let's just see how we compare in the province of Ontario to the rest of the country. There's the average, and they measure this in per million of population. Canada at 18.2. Nova Scotia and PEI are the best in the country in terms of donations. We are a little better than average in the province of Ontario. Saskatchewan, for some reason, is the worst in the country. They have the lowest deceased donation rates. The United States, you can see, is a factor much better than Canada, and Spain is more than twice as good as Canada at deceased donation rates. We've got to get into some understanding of why Spain is the gold standard here. Theories on that? How come?
Well, they've been working for many years to evolve their entire system. So first of all, they have in place their specialists. They're called donation specialists. And they're connected to the critical care units, and they work to make sure every potential donor is referred. And that's not happening in Canada. And we need to develop better ways to understand when the referrals aren't happening, how can we improve those practices? They've got that organized in Spain and do it very well. And they've actually been teaching countries around the world, including ours, how to advance that. When you can see in Ontario, they've actually taken steps to advance a procedure, a process like that with donor specialists. We call those the foundational elements of a high-performing system. Understanding every death, how those referrals move forward, being able to audit and educate where there's missed opportunities, having someone on site trained to have those discussions. That's all a part of that donation specialist model with coordinators and physicians leading the way to change the culture in organizations. In Spain, that culture has evolved considerably since they put these positions in place.
Ronnie, one of the things that we hear about is something called presumed consent. Do we have that? Do we need that?
We do not have it. We relish the conversation. It keeps us talking about something that's very interesting and debatable. Under presumed consent, it is presumed that you, Steve, have agreed to be a donor by default, unless you proclaim otherwise.
So the default position is we're all going to donate unless we
Correct.
expressly say we're not.
Correct.
As
And-
opposed to the other way around, which is the way it is now.
Correct. Now, we have researched presumed consent in jurisdictions all over the world, and there is no evidence that presumed consent standalone brings increased donation. There is no evidence. The reason for that is, one of the reasons for that is, a family is still brought in to give consent, even under presumed consent. And when you think about it, there would have been no reason for that family to have ever had the conversation. So there they are in the depths of sorrow, and the medical team says, we assume your loved one agreed to be a donor because didn't opt out. And they say, well, just a minute, I don't know if he knew what he was reading. We never had the conversation. I can't deal with this now.
So it doesn't get donation rates up.
It doesn't happen. It does not happen. So it seems like the silver bullet intuitively, but empirically, it is not.
Is that your view on this as well?
I think I would agree with that. I mean, I would broaden that concept to say what we really want to do is we want organ donation to be the norm. We want it to be absolutely consistent with everything else we do and everything else we believe in our society, that if someone can be an organ donor, they should be an organ donor.
So that's a cultural change you're looking
Exactly.
for.
Legislation, I think, may move the debate forward a little bit as well, but it's complicated, as mentioned before. I mean, it always strikes me as odd that the majority of the population would be willing to accept an organ, but we know that there are individuals or families within those patient populations who would probably not ever consider donating, and we need to do more and more to connect those two together. Organ donation has to be the normal thing to do, and I think that's part of Spain's success, because there's not much debate about whether anybody's going to be an organ donor, because everybody's an organ donor.
That's a bit hypocritical, isn't it, to say overwhelmingly, sure, I'd love an organ, but I'm not interested in donating one. How do you deal with that?
It's surprising. And I think it comes back to the goodwill. Still, most Canadians agree with organ donation. So saying you receive one makes sense. You agree, you think it's a good thing. I'd like to have one. But we all have to do our part to make sure that continues and happens, and having those discussions. I've been on the other side of that chair when a family was absolutely horrified that they didn't know what to do. They hadn't discussed it, they hadn't heard what she wanted to do, and they didn't want to make a mistake. It took them so finally they decided, you know, she does these sorts of things every day. This is who she is as a person. We're going to make the jump. We want her to be a donor. But they struggled with that, and we could help that struggle go away by encouraging everyone to make that choice.
If we just consider the history of the province of Ontario here for a second, and I'm going to rely on all of you to help me because my memory's not quite 100% on this. I think it was the Mike Harris government that actually set up the Trillium program to begin with. Okay. And I think as well, it's probably almost 10 years ago that the NDP in opposition tried to bring forward a bill that would advance presumed consent, but it didn't go through, right? There was not the political consensus to do it. Am I right on this too?
Correct.
Okay.
I think it was Peter Cormos.
Peter Cormos,
who's now deceased,
now
who
deceased
brought
MPP.
it forward when he was an NDP MPP. Yeah.
Okay, so where does that leave us today? Dave, I mean, have you got any ideas on how to, I mean, you're kind of a walking example of the benefits of doing this, but you've still got to manage to convince people to change their minds and change the culture around all of this. You got any ideas?
It does. It seems like a no-brainer. You know, it does. And I'm sitting here today. Without it, I wouldn't be here today having this discussion, Steve. So, but as far as me, the thing I've learned, and I really have learned this since my transplant. I've been an advocate and I've been getting out there, but it's education. I think Ronnie mentioned that earlier. And it really is education, and it's talking through all the myths and misconceptions. I've had many, many discussions on this with people because they've asked me not just my own personal experience, but then they ask opinions. And I've just found it's education. People have questions and they're just not getting them answered. So the beadonor.ca campaign is fantastic. It's getting out there. Social media is getting out there. They've been great tools, especially in the younger population, but it's still education, and it's talking with your families. There's still families making it to that situation that haven't been educated, to your point, and it's still tragic, and to deal with it, it's too much. It's overwhelming to deal with at that time. So talking about death is not something that we all want to do. It's not something we wake up in the morning and think it's the first thing on our minds. It's not, it's living, but it's an inevitable. And I think when we look at our overall assets in life, our life and our families and everything else, we try to put all those in place that if there is something that falls a line, it should be a part of the discussion.
Ronnie, I'd like your view on this because sometimes when people can't get a donor organ, they take matters into their own hands and they pursue extraordinary, and I think we can probably say borderline unethical approaches, like buying a kidney on the black market from somebody who's extremely poor in India or Pakistan or something like that. What's your organization's view of that option?
Talking about both living donation and organ tourism. So when you talk specifically about living donation, if I had a loved one who needed an organ, I would certainly publicly solicit. I'd do whatever I could within the law.
Within the law?
Within the law. The same time I say if we had enough deceased organs, we wouldn't do living donation, living donor transplants, because we're putting at risk a person in pristine health. In terms of organ tourism, I think Kim probably could address this better than I.
Well, you were in China recently, weren't you?
I was.
Okay, what's the story there?
Well, again, moving towards no one can do this alone. Even in Canada, Ontario needs the support of other provinces to perform well. We share organs across the country. That's the work of Canadian Blood Services, trying to float all of the programs. Internationally as well, we've been the beneficiary of Spain, other countries like the US coming to coach us and teach us. We're trying to do the same in countries like China, trying to advance their legitimate programs for deceased donations. So we believe if you focus on improving donation everywhere, including those countries that have typically been recognized for recovering organs inappropriately, we will change the tide.
You say inappropriately, but I'm wondering whether you think that kind of economic transaction needs to be criminalized.
That we have to focus on the legitimate practices, absolutely. We need to make sure that those programs get the focus and the benefits of training and education and evolve away from any kind of system that is not legitimate,
But
trusted.
That's
Yes.
promotional. Leslie, I'm wondering if you think we ought to go so far as to say that ought to be illegal and not permitted. You want to go that far?
Well, I think I wouldn't say that I have a soft spot about this, but I've looked after over the years a number of patients who have gone to other countries and have received transplants there, both from live donors and deceased donors. And I understand, I mean, desperate times call for desperate measures. So I think that focusing on improving our own organ donor rates, whether they're deceased donor or living donor, is the ultimate solution to this problem.
I get that, but you know what? If somebody were to go overseas and buy an organ on the black market,
Yeah.
and then for some reason it doesn't work, and they come back here, and they end up in your hospital, the taxpayers of Ontario are going to have to pay probably tens of thousands of dollars, if not more, to improve the care of this person who has, in essence, done something unethical or illegal.
I understand
problematic,
that.
isn't it?
It is problematic. And we provide care every day for patients who travel all over the world and bring back all sorts of interesting diseases with them. Sometimes diseases that they acquired overseas, sometimes their own diseases that were aggravated overseas. I personally don't think that we should compromise the care we're willing to provide to Ontarians because of the decisions that they've made. And I have cared for many, many patients who've returned from other countries with non-functioning or poorly functioning organs that they received overseas. It's not ideal, but I mean, I'm a physician. I'm obliged to provide the best care I can for my patients, and that's how I deal with that. Making it illegal will simply drive it further underground. Right. And ultimately, the best solution, as I say, is to make it unnecessary.
Dave, I have to ask you, we've got about a minute left here. Did you ever, while you were waiting for an organ to come through, think about doing it this way?
Never, to be honest with you. I wanted to live, of course, and I told you earlier I wasn't willing to give up. And to be frank and honest, I didn't really know even what trilliums function in with all of this. By the time I got sick, it was overwhelming for me. But I never ever thought of that. I know what our healthcare system is here, so there wouldn't be another place in the world that I wanted to be treated in here in Canada, and I was just hopeful that our system was going to come through for me.
Ronnie, you get the last word. If people want to register, which you want them to do, what do they do?
Go to beadonor.ca, and within 2 minutes, you'll be registered.
There you go. That seems pretty easy. I noticed the green ribbons, literal and,
Yes.
and pins that you're all wearing today.
Yes.
Pretty
That's-
obvious what that stands for,
That
right?
stands for organ and tissue donation and transplant.
There we go. A wide shot, please, Mr. Director, as we thank all of our participants for coming in today and sharing their views on this most important subject. And Dave, we wish you continued good health
Thank you.
with your good heart. And we're very happy for your success, and thank everybody once again for coming in tonight.
Thanks for having us on.
Help TVO create a better world through the power of learning. Visit TVO.org and make a tax-deductible donation today.